everyone. My name is Lindsay, also known as Animal Based Bae, and I'm here with Andy from CrowdHealth. Hello and welcome.
Thanks for having me.
Yeah, of course. Where are we at? We're in Austin.
We're in Austin.
Exactly. And so Austin is kind of just a cool, laid-back community. We do have a really cool sub-community that is animal-based and carnivore and all those things that are really focused on prioritizing health, wellness, eating right, exercising right, all those things. So how long have you lived in Austin for?
About 10 years.
10 years.
10 years,
Okay,
yeah.
cool. Do you love it?
And I love it.
Yeah.
I love it. I don't love the summers, although this summer wasn't that bad.
Yeah.
For Austin.
Yeah.
For Austin, but it wasn't bad. No, I love it.
Yeah.
Been here 10 years, and I actually kind of got into animal-based while I was in Austin. Met some folks that were
really?
doing animal-based stuff, and lost 35 pounds on animal-based and kind of continue to do that.
Did you?
It's been amazing. So
Where did you?
trying to get my 6 and my 8-year-old to do animal-based
Yeah.
too. They're not quite there yet, but we're working on them.
That's okay. When did you start animal based? How long ago?
Probably in like 2015, 2016.
Oh, wow. Okay. So you
Yeah.
definitely.
I've been around. I've been around for a while.
Yeah. Did you start animal based or was it?
It
carnivore?
started ripping stuff out of the diet.
Yeah.
And so I started with Whole30 actually. And then got into animal-based, soon thereafter. Just
Okay.
because some of the stuff on Whole30 didn't really jive with me.
Like what?
A lot of, I was snacking a lot. And there was this crazy granola that they allowed us to have that was date heavy. And I felt like I was snacking on that a lot. And that's just a massive amount of calories, right? In the form of carbohydrates. And I just didn't, I did Whole30 probably 3 different times. And I found that as I cut out those dates and the grains from Whole30, potatoes I cut out, those types of things, my experience along the way got better and better and better. And so eventually I cut out almost all, non-meat products.
Right.
So I'm sitting close to that. I always say I'm close. I'm 95%. I have a 6 and an 8-year-old who, they have birthday parties and things like that. And so I enjoy, and I think it's okay to go and cheat once in a while. So I do the cheats.
Yeah.
So, Dr. Ovadia, do you know Dr. Ovadia?
I don't actually.
Dr. Ovadia is a former heart surgeon. I think he still does heart surgeries, but he's gotten into metabolic health and been focused on that. And he had, I think, a really great analogy where he said, look, if you're wealthy, it's okay if you go to the nicest restaurant once in a while. Just don't go to the nicest restaurant every single day because that doesn't make any sense. If you're metabolically healthy, it's okay if you want to cheat once in a while. And my cheats are, I want to have, cake on my kid's birthday. I just want that experience with them. And so those are my cheats. And I know that given I'm metabolically healthy, given kind of an animal-based diet, that it's okay. It's okay once in a while.
I like the balanced approach too, and it's all, unique to you, and your cheat may not be my cheat, or, my cheat today may not be what I see as my cheat tomorrow, because, that cheat could actually rob my tomorrow, and then I all of a sudden don't like it, and maybe my cheat becomes different, or maybe my, cheat isn't a cheat anymore, and that gap kind of gets smaller and smaller.
Slippery slope sometimes.
Yeah. And so as long as it doesn't ruin, right, the tomorrows. But I think similar to healthcare, you want to show up to your lifestyle or to your diet or to your exercise and to your routine and always weigh the pros and cons, because the dose is the poison at that point. But first, being knowledgeable about how much poison you are getting, right? And so you have the choice to weigh the pros and cons of what is the benefits of this, and, what could be potential side effects that aren't desirable. And then you get to weigh those options. And I think that should always be the approach, even when you go into a doctor's office, let's say, right? Just being presented with the actual knowledge of what it takes to get healthy or to overcome disease, or to, just remove certain things from your diet and lifestyle first, before entering into anything that's given to you that could have worse side effects than, than that balance. But at least we know all of the things like pros, cons, benefits, and all that. So as being someone that is animal based and knowing that coming from Whole30, grains didn't make you feel good, and you prefer not to have that on a daily, consumption level, maybe for your kids' birthday parties or things like that.
Yeah.
Like the benefit there's more pros there because you're enjoying that moment, and like community is better, to me sometimes than just that trade for,
Absolutely.
oh, I should just have a steak or whatever. But overall, again, then there's an accumulation perspective. And I mean, I could dive down the rabbit hole too with all that, where it's just like all of those things. But let's dive in.
There's no guilt associated with either.
Right.
It's like one of those things where I'm having a meal with my 8-year-old who just had a birthday a couple weeks ago. And I know that tomorrow I'm back at it, and I'm not going to feel guilty about it.
Right.
It's like, okay, we had a great time, and she enjoyed it, and she and her dad got to eat cake together. It's okay. Let's move on tomorrow, and I know what my plan is going to be. And so there's no guilt associated with that.
Right.
So I think once you get into guilt and shame and some of these things around food especially, that where it becomes really unhealthy.
Right.
And so that's where you have to have some self-reflection around, like, okay, so why am I doing this?
Right.
Why am I having this cake? Is it because I really want to enjoy it?
Sure.
Or is it because I really have sweet tooth, and it's this self-realization a bit about why am I actually doing the things that I'm doing. And food, just given its nature, its requirement to sustain us, there's a power to it. There's a power to that food, and as long as you have control over it, then I think you're good to go on the cheat days. I also don't drink, except with my wife on vacation, overlooking the ocean at the pool. I'm like, man, there's something about having a nice glass of wine or whatever with my wife. There's just, so I cheat in those ways, but most of the time it's pretty animal based, which has been great.
Yeah, and I think instead of just extracting just that like moment of whether it be guilt or cheat or something like that, you have to look at the bigger picture of things, because that is what really matters, and myself too included. I'll have a glass of wine sometimes with family over the holidays, or, one of my main things is having like a martini during ski season, because it's like, I mean, I'm going bell to bell, just flying down. Typically the drinks happen afterwards, like just having like a martini after in celebration of, typically I go skiing on a ski trip every New Year's, and then, I'll have a martini kind of after that, and just like a little bit of a celebration. But then, I'm skiing, and that's sort of my like happy balance. And until that comes to affect me in a negative sense, then I'll do it if it brings me enjoyment. And of course, picking the right things too, where it's, I'm going to try to get the best quality as best I can of, of those things. I like to call them necessary naughties sometimes. Where it's just
I like that. Necessary naughties is way better than cheats. I like that.
Yeah, exactly. Like so when you switched to Whole30, what were you eating before that?
Garbage. Processed garbage.
Oh no.
Yeah, it was bad.
Yeah.
It was bad. I think you go through your teens and then 20s. I think it hit me in my 20s when I felt like I was super skinny growing up. I could eat anything.
Sure.
You think that lasts forever.
Right.
And in my 20s, when I went to college and I got the freshman, I think mine was like the freshman 20 or 25. I mean, it was like it was a bad transition to being like, wow, okay, like what I eat really does impact me.
Right.
And then I ignored it probably for a decade and continued to gain weight. And at some point, I mean, I got married, and and we had our first child, and there's a part of kind of that being like, whoa, hey, hold on a second. Like, I got to take care of myself, because I'm now responsible for not only, providing for our family. I have a child that I would like to see them grow up. I'd like to see them have children. I'd like to be a grandfather. And so you start thinking about all these things in the future. And around the same time, my dad had a stroke. That was unfortunately a doctor error, hospital error that caused that. So that was bad. But it does again make you think about, what am I doing now in my 20s, 30s, and 40s that's going to impact me when I'm in my 60s, 70s, and 80s.
Right.
And a lot of people don't have that long-term view, and for some reason, by the grace of God, I had that long-term view in my early 30s and was like, man, I got to start taking care of myself if I want to be here
And if you
forever.
take care of yourself, you're also taking care of your grandchildren.
Exactly.
Like, it's
Yeah.
epigenetics. This is the future. So we have to start thinking that way if we, care about our offspring and future generations. So
I think there's something about coming to Austin too, where Austin's is a culture of different varying opinions on food and all kinds of things, politics. It's all, we can go down all kinds of rabbit holes there. But
of course.
I think Austin was an inspiration for me, meeting a lot of people in, an animal based, or maybe it was a whole 30, but transitioned me to like, hey, I got to think about what I put in my mouth, and this processed stuff doesn't make sense, and it doesn't really make me feel good, if I'm being honest. And so those were the transition points for me that I all kind of culminated in. I gotta be a little more animal based. That makes me feel best. It has the highest probability for me living, until my 90s or even beyond that, hopefully.
And it may not be that way tomorrow, but we know that today this is what makes you feel good. And I think it's really cool to have these little sub communities like this that support this lifestyle and are like, wow, hey, I have my vitality back. Like, this should absolutely be something that is more talked about, in just media, in the food industry and things like that. And so speaking on, having cake with your kid or things like that during birthdays, I feel, at least my duty, I feel, is like up to us and to me to just, sort of fight the food industry just a little bit to hopefully bring better foods to the market and producers to, hold them accountable to what the ingredients that go into the meals, so that, these sort of birthdays don't seem such a heavy burden of like, what are my kids eating, right? So it's all baby steps. And then speaking of, between what you feed your kids at 8 and then when they go off to college, what are they going to eat?
Right.
And so as we talked about too, or as you just mentioned about gaining, the freshman 15 in college, I actually lost it. And the reason why I was sick, and I was sick I was diagnosed with celiac disease at my first year of college. So going into it, I was still struggling, just constantly in and out of doctor's offices, trying to get results and see what was wrong with me. Back then, celiac disease wasn't a thing, so they weren't testing for that. And then it was like, take this medication, take this pill because it could be this, and maybe it's this, and la la la. I was like, I don't want to take anything because maybe, and then have bad, results later for medication that I'm taking. It just didn't make sense to me. But I got sick and I needed to figure it out. And so finally one day, just kind of going through family history and things like that, my grandmother's sister had celiac disease, like severe case. She couldn't even go in restaurants that cooked with flour or anything like that. She'd be immediately hospitalized. So we checked blood test for celiac disease and it was positive. Okay, the day after, changed my diet immediately. Within 48 hours, I was instantly better. Like someone who was afraid to just like now eat anything because wheat was in everything from soy sauce to like makeup. It was wild. Like what a wild journey. And that was kind of my rabbit hole of understanding labels and ingredients and, just really being intentional about my choices and going into college where pizza parties and beers and all these things and, just grab something off the shelf like soy sauce and, make stir fry and all these things. I couldn't. I had to start learning how to cook and learning everything from scratch. And so that is sort of really where I really started to understand that like, hey, modern healthcare and just doctors, and they don't really care about the root cause of why this was happening. And with just a simple diet switch, it healed that journey for me, that moment in time of celiac disease. So back in college, so this was like over 20 years ago, was sort of when I joke with my family, or with my brother rather, when there's this what's his name? CeeLo Green, I think his name is. That goes, I remember when I lost my mind.
Yeah.
We always be like, when did you lose your mind? It was like pretty much that moment, because then you start reading ingredient labels, you open Pandora's box, you just like see all of these things that are like basically gonna kill you, and then all of a sudden the doctors don't care, and they're just, you know, they prescribe things for, you know, whether it's incentives and drinking the Kool-Aid and whatnot. And so that was sort of my path into really taking back my health, my vitality, and diving into holistic wellness. And so pretty much since then, sure, I had a job right after college where I did have health insurance, because that's just sort of what you do. And so that was kind of my trained mindset. It's like, oh, okay, I'll, you know, sure, of course, they have benefits, la, 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 la.
Right.
Then I was working in corporate for about 3 years, or 4 years rather, at the Home Shopping Network. Anyways, whatever. That's a long story. After that, I was like, I want to travel the world and pretty much go off on my own and do my own thing. Needless to say, I didn't have any health insurance since then. So been pretty healthy, no health insurance, and all of that jazz for quite some time now.
I love it.
And
we need to get you one of our T-shirts. It says uninsured on the front.
Yeah, I know. I love that for sure. So that's kind of, but it was hard to navigate an uninsured life, you know, and trying to find insurance policies, because, you know, they put the fear in you that like, this and that, and what about
FUD, fear, uncertainty, and doubt.
Yeah. Well, yearly checkups and all these things that you need, and blah, blah. I'm like, well, I feel fine, and blah, blah, blah. And so anyways, fast forward to today, where finally, you know, about a month, 2 months now or so ago, I've been really like in discussions with your team at CrowdHealth. So CrowdHealth, like, it seems like, wow, you found something that not only talks the talk of animal-based and healthy living and eating and all of these things, like you were mentioning, like what Austin sort of vibe brings, and like feeling like you really, like, this resonates with my values. But just knowing that I'm also 37 and 38, and sure, again, maybe it's another fear tactic that kind of like comes in my brain, where maybe just because I'm getting older means like, I need to go to the doctors now and all these things, which I still don't think so, because I'm still very healthy and actually like feel like I'm getting younger in some stances, but I still feel like it's good to start having this community where people are sharing not only doctor recommendations that love our lifestyle, but also, you know, the uninsured and paying out of pocket and all these things. So enter CrowdHealth. And
we're glad you're a part of the crowd.
I know. I feel like so cool. I'm like, wow.
We think we're like cool because you're a part of our crowd. So it's a mutual coolness.
Yeah. So tell us about how you started CrowdHealth.
Sure. Yeah. I mean, not too long after I moved to Austin, I was running a healthcare company and I sold it. And so I had to go figure out health insurance, because a lot of us get health insurance to our employer. Yeah, I mean, we're a community of people who take their own health seriously. We just had the first half of this podcast talking about how important it is that when we do things in our 30s, 40s, and 50s, how they impact us in our 60s, 70s, and 80s. And so we have a group of people who say, hey, I'm healthy, I'm taking care of my body, I'm doing it right. I'm willing to help other people who have something come up. And so, you know, we've got a community we've signed up almost 9,000 people so far. And we fund lots of accidents, you know, people doing mountain biking, you know, face plants, living life outside. A lot of people who are having babies. So we got a lot of pregnancies, we got a lot of accidents. And so, you know, those are the types of things that we're funding, as opposed to all these chronic conditions associated with lifestyle choices, primarily eating processed garbage. Right. You know, 25 cents out of every dollar that you spend on healthcare goes to diabetes. And we know, I believe, that diabetes can almost be eradicated, at least type 2 diabetes can almost be eradicated if you go on an animal-based diet. Right. And so we've got lots and lots of people who agree with that, do not want to subsidize, you know, that lifestyle. We actually have a T-shirt that says, stop subsidizing vegans.
Yeah. Exactly.
So we got a lot of people out there who want to fund others who believe in this lifestyle choice.
Right.
So I was just saying, I started, I moved to Austin 10 years ago. I had healthcare through my employer, but I had sold my company, and so I was losing my healthcare. And as a result of that, I had to go find some other options. So I went what I thought was the only option, which was Obamacare. And so for me, my wife, and my two girls, it was $1,200 a month, $12,000 deductible, which means that we're paying like $25,000 or something like that before the health plan pays a dime.
Right.
And I was like, okay, well, this is, I guess, what all I have. And I kind of joke it worked until I had to use it.
Sure.
My little one, who was 1 at the time, was having recurring ear infections. And so we had to go to the ear, nose, and throat doctor, who said, oh, she's got a hole in her eardrum. So you have to get tubes in her ears. We're like, okay, we'll go and do that. We went to an in-network place to do it, got the bill, and it was $8,000. And I was like, wow, it was a 15-minute procedure, and it was $8,000. And then my health insurance plan said it was medically unnecessary, and so they weren't going to pay for it.
Oh my gosh.
And so we had to stroke an $8,000 check to the local, surgeon to do her thing. And I was like, hold on a second. Like, this doesn't make any sense. When I need you, you're not helping me in something as benign, as a hole in my daughter's ear that was, I know, resolved because she stopped having ear infections.
Typical insurance move. Huh?
It's an insurance move. And the more I realized, more I researched, 1 out of every 6 of those claims are denied. So you have a 1 in 6 chance when you submit a claim that it's denied. And if it's a $100 bill, it's not that big of a deal. If it's an $8,000 bill, it's a big deal. If it's a $25,000 bill, it's a real big deal. And so I said, there's got to be a different way of doing this, in a group of people that share the same lifestyle as me. And so we started Crowd Health, which is basically, like I said, a group of people who have chosen to live a healthy lifestyle, who are willing to help other people in their community when they raise their hand and say, hey, man, something bad happened to me, because it could always happen. Flukes happen. And it's been an incredible journey. And we've funded $8 million worth of bills over the last 2.5 years. 99.8% of the bills that have been submitted to the community have gotten fully funded. And it's everything from a virtual pediatric visit of $69 to a brain hemorrhage, which was hundreds of thousands. We've had 20 cancer cases. We've had all kind auto accidents, motorcycle accidents, big and small, have been able to be funded by the community. So
and kind of all those incidences that aren't necessarily something that you could change from diet and lifestyle, right? It's
exactly.
Yeah, they're trying their best to eat and live a healthy lifestyle. Not that they have to abide by, you have to just eat this amount of steak and this amount of butter or whatnot.
Exactly.
It's just really having more intentional choices with your food and lifestyle.
Yeah. 75% of the expenses are wellness visits, so people just go into a OBGYN or a pediatrician. Injuries, which means that you had a mountain bike face plant, you're out doing life and something happens. Or pregnancies, which we have a lot of people in our 20s and 30s. They have babies. Those things, sure, I'm happy to fund those things. So the great thing about us is exactly where your money is going.
Right.
So if I have a broken arm, and you agree to help me, your money goes directly to me to help me with my broken arm, as opposed to United Healthcare or some big healthcare conglomerate where you're like, I don't know where my money is going. Yeah. So
let's break this down then. So real quick, we're live. This is Andy, and he's from CrowdHealth. So if you have any questions about all things just insurance, as well as what this carnivore community is about, we're trying to build up an exclusive community that supports, what would you say? Maybe longevity, or just that supports a community that strives to be healthy, from food choices to activity levels to all of these things, instead of paying for premiums for sick care, essentially, for people who are sick. So I'm just trying to look to see if we have any questions. So I know this is new. This is a bit of a different topic for me. And so this is why I kind of wanted to get you in here live just to see if, the community has any questions too, because I know I have lots of questions. So starting from step one into this. Okay, so people how does one even get accepted into the community, right? It's like if you believe in eating right and exercising. Is this step one? So just walk us through.
That's step one. And so we've got a specific crowd of people that we're calling the carnivore crowd.
Okay.
So while it's a carnivore crowd, it's more of an animal-based crowd where most of your calories are coming from animal-based sources.
Yeah.
And to get into that, you actually have to have either a visceral fat level that's in the bottom 25%, or you have to have a fasting insulin level below 5.
Okay. So if you are on my live and you're tuning in, if you go in and you type the code capital animal BB, you can definitely get entered into the community. And so this scan and this fasting insulin test is something that you would submit after a few months of being in the carnivore community, right? So that we can kind of see that we are a healthy individual entering.
Within the first 3 months that you join, you have to submit one of those to stay in that community.
Okay,
so
great.
Or you can do it beforehand if you want to and submit it afterwards, but it has to be within 3 months of you joining or after 3 months. So just
you're here supporting us the whole way, right? So we can ask you guys hey, can I get blood work done? And so how does that work? Like the question of, hey, Andy, I want to go get my fasting insulin and also my visceral fat tested. How do I do that and where do I go?
Yeah, you can call into us or you can email us or you can text us and say, hey, I want to get these 2 things done. Where's the best place for me to go and do it?
Great.
Or if you have a place.
Anywhere in the U.S.
Anywhere in the U.S. We're all 50 states, Puerto Rico, D.C. Yeah.
Oh, okay, cool.
So all over the place. So yeah, the great thing about starting a company is I could just do what I want. And one of the things I wanted, which I hated about health insurance, is having somebody internally I could talk to, as opposed to calling a call center in Singapore or something, where you're like, what the heck? So you have a care advocate internally. You can ask him or her anything that you want. They will direct you. They will be your ally, your Sherpa, as you go through the medical journey. Right. So yeah, go get your visceral fat, which is a DEXA scan, or your fasting insulin. You can do that at any lab. We can help you find a lab.
Great.
You submit that to us either before you join or after you join. You use your code and you get it's $99 for the first 3 months. $50 comes to CrowdHealth to pay our bills. Okay. $49 goes to somebody else in the community that is having a health issue of some kind.
Okay, and so is that $49 determined by you then? So our membership, for, 60 to you, did you say?
Say again?
How much to CrowdHealth?
$50 to us.
50 and then 49. So and that's just the membership, and then 49 goes to you to decide kind of within the community where that goes, right?
And we'll ask you every month.
Right.
Hey, would you help Mary, who fell off her bike and broke her arm?
Sure.
And you can say yes or no.
Right.
Or you can automate that. If you want to say yes for everyone, you can.
Okay.
So money goes from your $49 goes from you to Mary. Mary has an account with us at CrowdHealth, so that let's just say it was $1,000. And so once she has $1,000 in that account, then she can go and pay for her broken arm.
Cool. So the $49, it's garnished off of our membership. So it's not like I say yes and then pay an additional money, or do you have that option?
Yeah, it's we ask you twice. One is for $50. Yep. That's automatic. That's just on the anniversary date of when you join, and it goes directly from to us.
Great.
And then we'll ask you throughout the month for that extra 49, and that 49 will go to Mary. And so you actually you have 2 invoices per month, but it's because one's coming to us. We don't touch the other amount. It goes directly from you to Mary's account. And so she has enough money to pay for her broken arm.
So what if I said no to Mary?
Right, you can say no.
Yeah.
We will ask you again and give you another option.
Okay.
Let's just say somebody wants help with something that you don't want to help them with. I don't know what that would be. But you can say no. We'll ask you again. But if you say no multiple times, we let the community know that you're somebody who says no, 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 no.
Sure.
Right.
Right.
So if you were to ask for help, we would let the community, over the last 10 times we asked you, did you
See.
say yes, 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 yes,
Right.
or no, 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 no? So you know if you're a good member of the community or not.
Right.
So, and we've done this, I think we're at our 20,000th bill or something like this.
Okay.
And so the system really works well.
Yeah.
It's not a burden. Again, we just ask you once a month, you know, and you can put an auto set that says, hey, everything that, you know, the member's a good community and the bill is reasonable, I'll say yes to, and you can automate that if you want to, or you can manually do it and go, you know, yes or no.
Right.
So it's super easy, but it does have a connection with another person in the community as opposed to sending my money to United.
Totally.
Right?
Yeah, because you don't know where that money goes. And I struggle with that because where does it go? You know, funds, big pharma, and at least it goes somewhere if you're not using it. And which is always my struggle with healthcare. I'm like, well, if I never go to the doctors and I never have these bills and I never have, you know, all these things that get billed to insurance, shouldn't they just give me money back for being healthy? And that's never the case, right?
Yeah.
Because they just take. And then the transparency issue is the fact that you don't know where it's going. Here, it's really nice because you know that $50 is going to you guys to keep running and to keep helping us, like not only from a support standpoint, but also just to, you know, like a support standpoint with an actual human as opposed to a call center, as well as the support of, you know, your resources, because now you guys have sort of a list of recommended doctors, which is super nice. And I know we talked a little bit, you know, about doctors and your daughter going in for the eardrum surgery and whatnot. And now you're growing too and very resourceful, and many people are looking for that. We are looking for doctors who don't give us the side eye when we're like, yeah, we eat meat. And then they think we're crazy. And then they want to prescribe us a statin and for a high LDL, which isn't the whole story, right? And so
Exactly.
I think the people that do believe in real health for sure is this is really something exciting, I think, and something that I haven't seen before. So thank you so much for having this platform. And thank you so much for this conversation with just being like transparent and, you know, where the funds are actually going.
Yeah.
So that's really exciting for me too, is just to know that if it doesn't go to me, it definitely goes. And I know who it's helping exactly from just the transparency. And then you also have like a little chat and a Telegram and a community that's actually talking to each other.
Yeah. Yeah. We've got a decent sized community. I think, you know, I don't know, it's several hundred people now, but there's a lot of chatter on it around, you know, what doctor are you going to? Your doctor said a statin. What do we do? Do I change doctors? These types of things. And so it'd have a good, lively conversation because we have people who are hardcore carnivore. We have keto. We have Whole30. We've got all kinds of people within this community who are, you know, duking it out, which is kind of fun, and it's all done in a respectful way.
Right.
One quick story on this, direct story. We had a 19-year-old Abby in Tennessee who cut off her fingers in a boating accident. And you can imagine the bills were tens of thousands of dollars.
Sure.
And so we went out to the community and we said, hey, will you help Abby with, you know, this reconstructive surgery and all kinds of things? And people were like, absolutely.
Sure.
We actually had people come back and said, hey, instead of asking me for $100, can I give $200?
Oh, I love that.
Because you know that there's a person on the other side of this that is struggling with something, as opposed to United Healthcare. We have people who have miscarriages. Again, we have women who come back to us and be like, I know what this feels like. I know the pain that they're going through. I can't really help because I'm 1,000 miles away, but if I can give more money to that family just to help them, I'd love to do that.
Right.
Like, that's the power of like being in a community of people who are getting after it in the same way and are willing to help each other. Like, it's a cool thing. I feel great writing a check to Mary or Bob or whoever because I know I'm helping them, you know, as opposed to United Healthcare, which I think they're screwing me, you know? So that's the difference. Do you want to give money to somebody in your community, or do you want to give some money to, you know, a big, massive corporation that's one of the top 5 or 10 largest in the world? Right.
And I think it's a good kind of hybrid model too, where not only are we going back to just sort of that tribe, like what's in our small community, even though we're leveraging some of these things, like such as, you know, technology from our support system on the Telegram to the apps and to all these things, it's helpful. Like, we can use modern, like, happenings today, whether it's technology, even modern medicine, sometimes for for specific needs when it's needed. However, to use that chronically as a crutch is the issue. And
Right.
so I feel this is a nice hybrid between getting back to that tribe mentality, sharing what works and sharing what doesn't via, whether it's doctor resources and things like that. And also like what's just worked at home with feeding your kid animal based and all of these ideas. And then as well as, bringing the community together financially too, to support your, your little tribe.
Yeah.
And I think progress is also unlearning or shedding, and it doesn't always have to be accumulating and moving forward and all these things that sort of I feel like we're pressured into do. It's just this like constant like busy accumulation, all these things. Progress also means unlearning and shedding and just sort of getting back to what we were once. It's just that tribe and human and and so I think we're starting to see that shift in the food system as well too, with the animal-based community growing and getting back to eating nose to tail and really like simple foods and not so much processed and all. So it's just like in my brain, like healthcare also looks like process, right?
Yeah, we've been psyoped to think that we have to have health insurance. And if you don't have health insurance, what are you going to do?
Right.
What are you going to do? It's like, well, what have they done for the hundreds or even thousands of years before you had health insurance? Your community gathered around you and they helped out and they were willing to, step in when they need to. In the agrarian communities, if you got sick or hurt or injured or whatever, and you needed the fields plowed, somebody would come over and help you and plow your fields with you. And like, that's the beauty of this is we're kind of getting back to where we, I think, should be. Whereas I feel like over the last 50 years, especially, the government insurance have kind of come in between me and you and said, hey, you don't have to help Lindsay. You don't have to do, we got Lindsay. And it was like, no. Your community should come around you and help, right? Like that's the beauty of a tribe.
I've also kind of been astray for quite some time too, like running away from the system. Luckily, I've had doctors in my community and just people that I know in the medical field and love and trust, and then also just being very intentional with my life and research and learning and all of these things to take control of my own health. And what I really love, and sure, I've had some incidences where I have had to pay out of pocket for things like, I didn't break anything, but just things that did have a hefty bill for like an emergency standpoint, nothing chronic illness or anything like that. And so I would have really loved to have CrowdHealth back then, on my side and as a support. So I really love that this is here from a financial standpoint too, because what you guys do at CrowdHealth as well is you almost cut medical bills in a third of what they charge via, through insurance and all of that, right? Because doctors are really looking to work with patients who do pay out of pocket, right? And so we're kind of considered a community that does pay out of pocket.
Yeah.
Can you tell us?
And they love that. They love that. So every doctor has about 3 billers to bill for health insurance.
So it's just like,
they spend a day of their week fighting health insurance, whether getting pre-authorizations for procedures or fighting on behalf of the patient because the health insurance denied it. And so what we come in is like our members come in and pay in cash.
Yeah.
We enable them. Like I said, if Mary has the $1,000 bill and we can fund that before she even walks in the door and says, here, doctor, here's $1,000, that doctor gets paid immediately. They don't have to have a bill or bill it. They don't, have to have massive fees to build these things. And so doctors love it. So they're saying, hey, bring more people to me because I want to get rid of insurance too and just take cash pay patients.
Right.
And as a result of that, of taking away all of that middle layers of expenses, we're able to get the prices down by between 50 and 70% of what health plans pay. And as a result of that, not only you have a bunch of healthy people who are in the same group funding each other's health expenses, which is a lower utilization of healthcare, but when you do utilize healthcare, we can get the bills down significantly. And we negotiate on your behalf. So it's not like we're asking you to negotiate with your doctor. All we ask you to do when you go to your doctor is say, hey, do you have a cash pay price? And typically that's much, much lower than what the health plans pay.
Right.
If you have a big ER visit, you get the bills at the end, you submit them to us, and then we actually have attorneys who will act on your behalf to negotiate with the hospital to reduce those bills. Let's just say you have a $20,000 ER bill. We reduce it to 10. We come to you and we say, hey, we reduced it to 10. Is that okay? Can we go get it funded? Yes, great. We'll send it out to the community. Within about a week, we'll have that $10,000 sitting in your account, so you can then go and pay that ER bill.
Right.
Super simple. If you're in the ER,
so good.
the last thing you want to worry about is having to pay it. And a lot of these Affordable Care Act plans, you've got $5,000, $10,000, $15,000 deductibles. You're like, oh my gosh, like I got to pay $5,000 or $10,000 as a result of being in the ER.
Yeah.
For Crowd Health, all we do is ask you to pay the first $500 of any health event. You have to have some skin in the game before we'll fund it to the rest of the community.
Sure.
So a $20,000 ER bill, we get it down to $10,000. You pay the first $500.
Yep.
We'll fund from the community. The community will help you fund the remaining $9,500, and then you use those funds to go and pay the ER bill. It's super simple.
Yes.
And you don't have to deal with the big explanation of benefits that your health insurance plan pays you. You're like, what do I pay? What do I not pay? What do you? It's so much easier than health insurance.
I love that. And yeah, I was talking to Josh, who kind of was the one who just, we chatted all things CrowdHealth, and he got me really up to speed on what you guys are all about. So
Yeah.
I love that. And I was even saying, okay, well, what happens if you have sort of like pre-existing conditions? And by pre-existing conditions, meaning like, I think it was 6 months ago or more than that, I ate a piece of raw heart. Not that, I actually had raw heart this morning, so I still do it. But I got raw heart against my better judgment from a place that I wasn't, that I didn't vet. And not that I still think it was a bad choice anyways, by looking at the labels. It was grass-fed, it was local, and it seemed okay. But I had eaten a piece of raw heart. Essentially, I got an immediate, pains, and it was a whole intestinal inflammation. I don't recall what the actual diagnosis was, but it was just my whole system was inflamed, my intestines and my gut, my GI tract, and all of that. Anyways, and then I was in the ER, pretty much very quickly after like 2 days of just agony. I was like, okay, I got to do it. My body isn't like expelling it, right? So then I talked to Josh, and I was like, well, what if you have, these pre-existing medical bills? I was like, you know what? Like, when I said that out loud, I was like, there's no way I'd want to bring that to CrowdHealth, because I feel like that's a burden, for them, where it's like, I want to feel like I'm helping the crowd out first.
Yeah.
So that it's like, so there's also this mindset too, which I really enjoy about wanting to enter this crowd that feels responsible too, where you are a responsible individual for your own health. So not only are you doing that through food and wellness, and then if something happens to you, that's fine, but you're a part of this community that you also want to give to, for sure. And kind of like you were saying with that story too, it's like, hey, can I give 200?
Yeah.
And giving also does come back, right, in receiving. And not that it's always about giving and receiving, but it's like the fact that I want to give before, not even with the intention of receiving. It's like, no, I don't want to like show up with my baggage almost, It just feels good from that standpoint. So
yeah, the pre-existing condition kind of clause is exactly what you're talking about. It's like people need to be personally responsible for what they currently have going on. If something happens when you're a part of the community, then let the community help you with that. Right. So specifics around this is, we look back 5 years. If you've had something happen in the last 5 years and it happens again after you join, for the first 2 years, it's yours.
Yes.
After that, the community will help. Like, you've shown that you're a part of the community.
Yeah.
You've shown that you're not trying to dump it on the community.
Right.
But something bad happened, and you're like, okay, well, you're one of us now. Like, come on in, And so that's the way that it works. A lot of times if people have, some chronic condition, high blood pressure, and they can't figure it out with lifestyle, and they have to take medication as a last resort, a lot of that stuff is so cheap. Like, don't worry about it. It's $15 a month or something like that.
Sure.
My family saved $20,000 last year on health insurance.
Gosh. So let's talk about this. People approach like breaking free of the system, and it's very scary for them.
Yeah.
And so it's I know running without health insurance for quite some time has been like, it felt like a gamble, but I always was active.
Rebel.
And yeah, I'm such a rebel. Drink raw milk, and I'm rebel too, and eat raw meat. And so, but again, like I said, as I'm aging, I would like to, gracefully, of course, I would like to just be more involved in what that means for, potential accidents that might happen, where you'd be a little bit more resilient when you were younger. And so I was more confident in that. So from a single person that is maybe getting older, like me, myself, in my age demographic, 37, I want to have kids too. And so all these things.
Yeah.
So from that perspective, to also families, what would you tell somebody who's just like, I'm scared? Is it going to cost more? Like, I don't understand from a savings perspective, as well as from a just like releasing that security from.
Yeah. Man, I think it's great for families. I really do. And like I said, my family saved about $20,000 last year from just healthcare.
And you're a family of
four.
Yeah.
A family of four. And think about, a lot of the people listening to this are going to be into alternative ways of getting medicine, non-Western medicine ways, functional medicine, integrative, naturopathic, those types of things.
Yeah.
Health insurance isn't paying for that. Those are things that you can submit to the crowd, and they're more than willing to help with those types of things to get to the root cause of what's going on with your body, as opposed to a symptom or treating the symptoms, which is a Western medicine way of dealing with things, versus the root cause. It's like, what health system do you want to be a part of? Root cause or treating the symptoms?
Right.
And I would just say, man, come to be a part of us. We're all about root cause. And, you're going to save, a family of four will probably save somewhere between $6,000 and $10,000 at a minimum, assuming no big events for the year. If you have a big event during the year, it's way more than that. You'd save way more than that, because you don't have the $10,000 deductible that you would have with Affordable Care Act. So I think it's less risky to go with CrowdHealth, knowing what I know, which is all the details internally, right, than going with a big health insurance plan and hoping that they're going to pay for things. You just said, kids may be in your future. I don't know how you think about hospital versus home visits, but here's a crazy stat, or a home birth. Here's a crazy stat for you. What percentage of births are done at home currently in the United States? Any guesses?
0.009%.
It's 1.6%.
Oh, wow. Okay.
In CrowdHealth, it's 40%.
Oh, wow. That's so great.
Yeah. And so these are a group of people who are like, I don't want to do hospitals.
Right.
I want to do what is naturally how it's been done for millions of years. Like,
I'll be the 40.9.
Right. And so then we give them the support, like get your doula, get your, all the things that you need to do that correctly and make you comfortable. And that's what it's about. That seems less risky to me than having your baby in a hospital where infectious, things happen all the time. And so I think it's less risky as a family to go with CrowdHealth. Anybody from the insurance side of things would be more risky, but 99.8% of the bills have gotten funded with CrowdHealth. 1 out of 6, about 16, 17, 18%, depending on the stat, get denied at health insurance plans. So which one do you want to be a part of?
Yeah.
Right. Like that's the ultimate question. And like I said, we've had NICU babies. We had a baby born with Down syndrome, was in, I think, NICU for 4 weeks, had to have a heart surgery because they had a hole in the heart. Like,
wow.
The crowd took care of him.
Wow.
Little Judah had his heart surgery not yesterday, the day before, Wednesday, I believe.
Oh my gosh.
Yeah. And so that is one of the worst case scenarios.
Sure.
For a baby, and the crowd was there. Like, he's a member of the crowd.
I love that.
So that's just a great part of who we are as a community.
Great.
So I would say it's less risky. That's my pitch, and way less expensive. So
and then they could always try it and then go back. Correct.
For sure.
So let's say, because it's almost, so we're in September, and so October, from what I do know about whatever corporate life and insurance policies, October comes around, and that's sort of enrollment period, and if, let's say, they do try CrowdHealth and then they're in 3 months and they don't like it, which is not really the case. I've seen from, and heard from testimonials of people within the crowd. I guess, how do they go back, or do they go back, or how does that work?
Yeah, if you're a part of it, depends on what you're with. So if you're with an employer, you have to make a decision typically between October and December. So we're sitting here in September now. If you decide on CrowdHealth and you don't like us before the end of your enrollment period, again, it's somewhere in the October to December period, depending upon your employer, then you can choose your employer. If you miss it, then you have until January, I think it's 15th this year, where you can get the Affordable Care Act.
Okay.
If you miss that, then you're stuck with us until the end of the year. But I'll tell you, like, our attrition rate, or the number of people who leave, is so low.
Okay.
I mean, it's 86% of the people stay with us from year to year, and the number one reason why people leave is not because they're unhappy. It's because their corporate health insurance paid 100% of their health insurance.
Sure.
Right. And so it's like, it's hard to compete with that. It's so rare, and it's becoming less rare. It's more rare, less often, because health insurance rates are going up. Companies are starting to say, no, employee, you have to pay a little bit of this because I can't afford paying all of it anymore. Sure. So, but those are really the 90% of the people who leave for that reason. Interesting.
So when they sign up, the other part about it is how, okay, if you use my code animal BB, you can get $99 a month for 3 months.
Yep.
Correct. And then after that, how much is it?
It's $50 to us.
Yep.
And then $135 to somebody else in the community. Okay. So $185 total.
Okay, great. And so
for an individual.
Right.
For a family, let's just say a family of 4, it's $50 a month per person. So it'll be $200 to us.
Okay.
And then $405 to another member. Okay. So great. That's $605 total. Great. And that's compared to, for me, the Affordable Care Act this year would have been $1,400. So I'm saving, let's say, about $1,000 a month. And I had a $14,000 deductible. So if I went into the hospital today, I'd be responsible for that before the insurance plan would pay anything.
Right.
If I go to the hospital today with CrowdHealth, I pay the first $500. Right. So there's a massive difference there in terms of if you have a health event with CrowdHealth versus health insurance.
Right. Yeah.
People need to understand deductibles, co-insurance, which means above the deductible, you actually have to pay a percentage of it too, co-pays, premiums, all this jargon that we get rid of, and so much easier.
Yeah. And I've kind of been like living in a world, like I said, since I've been stray, of none of that. So it was actually interesting to have a conversation with you guys too, because I'm like, wait, you guys are paying for what?
Yeah.
And like, just kind of comparing it to what, co-pays are and the insurance, and then what they're not paying for anymore. And I do annually go to the gynecologist, though. That's another rabbit hole I went down to. I'm like, why? It's another thing, whatever. That's a whole nother story. So I'm not going to get into, because we don't have that much time, but
really quick on those, though, is those wellness visits. You get one wellness visit per year that's fully fundable, so you don't have to come up with that first $500.
Oh, okay.
So it is. You can go to your gynecologist or pediatrician or primary care, vision, or dental. You can pick one of those 5.
Oh, cool.
And then within one of those, you can do a full set of labs too.
Okay.
So if you do labs, I do labs twice a year typically.
Yep.
But one of those would be, fully fundable by the community. I eat the other one typically because it's not that much. It's $100 or something.
Sure.
And so it's below that $500 threshold. I look at that and say, okay, I'll pay. I save $10,000 or $20,000 a year so that I can go and pay for the stuff that I want to do. Like I do multiple labs. Not everybody wants to do multiple labs.
So so that was kind of my question. What I was saying too was that they'll only pay for so many labs, that actually these tests aren't really exactly what you want to know for a really in-depth understanding of where you're at health-wise, right? For instance, they don't do a fasting insulin test.
Sure.
Which they should do.
They should do.
Because that is a huge insight into your metabolic health, and then therefore just your overall health, right? Root cause of a lot of these diseases and issues, in my opinion. So I think it's even a $10 add-on, sure, but they still want you to pay for that. And anything outside of their sort of like generic lab tests, they want you to pay extra for, extra for. So from a lab test in your annual visits and things that are 100% covered, what would that include from lab
Up
tests?
to $300.
Okay.
So
and it could be anything.
And whatever you want.
Okay, cool.
And the other benefit of us too is we can get you wickedly inexpensive labs.
Right.
So my entire setup is $100 pretty much every 6 months. And I do fasting insulin, I do kind of the metabolic and lipids and all those kinds of things. I don't do some of the crazy stuff. I got LP once just because I was interested. I don't have to really do it again. That's more of a static number. And so I do some of those things like once and be done. But I mean, I think there's probably 5 to 10 metrics you need to look at that are really, really important. And I get probably 100 different lab tests just to make sure everything's all right. But it's $100.
Yeah.
And maybe even just $200 if you want to go to that next step.
Sure.
I'm looking at the basics. I'm looking at HDL, triglycerides, fasting insulin, those types of things that show, am I metabolically healthy or not?
Right.
And then you have the full panel of all the other stuff just to make sure something else isn't out of whack that I don't typically look at. But if there's something going on with your body that you just, thyroid cancer or something like that, and it's going to pop up there, I just look at that just because.
Right.
But I'm really focused on 5 metrics basically.
Yeah. No.
And tracking them.
Good. Yeah. And then, obviously also finding a physician that will sort of, I guess, like give you those, what do you say?
Orders.
Yeah, give you the orders, basically. Yeah. So finding that physician would be helpful. And so again, like we're a growing community that is
we've got you covered
doctors.
On that.
So it's super cool.
So our provider of labs will do that for you. We'll provide you with a doc who can give you the orders for pretty much whatever you want. So labs and to some extent imaging too.
Right. Okay, great. I love this. Okay, so
by the way, we had a guy that I know really well. I sit in the office with him. He's like, man, I've had massive headaches for the last 6 months. And I'm like, dude, did you go get an MRI? And he's like, isn't that like $5,000 or $6,000? I was like, no, guy, it's like $500. Like, go check it. Like, when you get out of the insurance world and into the cash pay world, everything changes.
Sure.
Right? I was like, if you're worried about this for $500, you can go get an MRI. Right? It's under the $500 limit, so he's funding it, but it's not $5,000.
Right.
Came into work today. And I said, how'd it go? And he's like, I'm clear. And I was like, how do you feel? And he's like, man, like it's such a weight off my shoulders.
Yeah, it's not looming.
And he's like, for $500, I do that. Yeah. But just like for $150, I'll go do a DEXA scan, right? Like it's not that much in the grand scheme of things, but it's a weight off of your shoulder. But you wouldn't do that for $5,000. Right. The decision point changes when you get cash pay prices. So I think you can actually utilize more healthcare because you're paying much lower prices, and you can do some of these things that you normally probably couldn't do. And look, I'm not advocating for going and doing random MRIs. There's a massive amount of, stuff that happens there, radiation and things. But like the guy's had a massive headache for 6 months. Like, go check this out. Like that makes sense.
But like pros, cons. That's a pro. He's now probably not chronically stressed in his brain with this looming over him.
And he said to me, like, look, he's a CrowdHealth member. He's like, look, if I had health insurance, I couldn't have gotten this. Like they wouldn't have approved it.
Right.
Or I would have had to go through 3 different doctors, my primary care doctor, a neurologist.
Right.
And then, to go get my MRI. And instead with you guys, my doctor's like, go get an MRI. Got the MRI that day. Got the test the next day, the results the next day. And he's like, man, I feel great.
Cool.
Like, that's how healthcare should be, I feel like.
I know. Yeah. If it should feel supported. You should feel heard, you should feel seen, and it needs to be back to like the tribe, back to feeling like personalized in ways, and then the community is there for you. Yeah. As opposed to just kind of like leaving you astray, and then have all these medical bills, and then also if you are healthy and you're paying for insurance, paying to big pharma that's not even doing jack for your health, and
especially when most of this stuff can be dealt with a lifestyle change.
Right.
One of the primary missions of the company when I started it was 200,000 families every year go bankrupt due to a medical event, even though they have health insurance. So these are people who have health insurance, have something happen, and still go bankrupt. And, so I look at this as like, man, the system is broken when people are going bankrupt over a medical event when they have health insurance.
Right.
And so nobody's gone.
Literally no insurance. Like there's no support.
There's no support. Like you think you're buying into something that keeps you out of financial distress, only to put you into financial distress.
Right.
And so nobody's gone into medical debt with CrowdHealth. Nobody's gone bankrupt over the last 3 years. We've had 9,000 people sign up. Like that's the way I think healthcare should be.
Yeah. No, this is really cool. And thank you so much for providing this platform for us. Like I feel, like I said, I mean, after, over 20 years of just kind of being stray, I feel like I found like a little health community for holistic health.
Well, we're honored you're a member of the community.
Yeah,
it's cool
of course.
To have you on.
No, thanks, Andy. And to just kind of keep updated, stay with me on Instagram or YouTube. And so if you're curious, just I guess if anybody's just curious about it before signing up, don't reach out to me, right? Because he and his way and him and his team of support is there to help you. So reach out to, where can we find you?
Yeah, joincrowdhealth.com/carnivore is the best place to go.
Great.
Lots of resources there, lots of FAQs, things like that. Carnivore Crowd on Instagram is a great place to go on, to get a lot of the background of what we do and how we do it. And then join CrowdHealth on Twitter or X.
Yeah.
Excuse me. So
yes.
Yeah.
X, Twitter.
Lots of places to find us.
Okay, great. And so, so we know, and I'll put those links down below too, so that you guys can click on them, navigate, do your own research, but also it can be a lot to research health insurance. Like I said, just like getting back into that mindset of like, having that support and not being so much on my own it's a heavy lift, and you do have to research it a bit, but just know that CrowdHealth is absolutely here to support you and to answer any questions, so you are not alone and you are not just a number. So
if you go to our website, there's a link there. You can actually schedule a call with somebody internally. So you can take a 15 or 30 minutes to talk to people, and if you have questions specifically that you can't find answered on the website, or just want to validate that there's somebody behind the the phone, you can talk to Jason or Grant, who are internally at CrowdHealth, who are there to answer any questions that you have. So it's more of a scheduled thing where you pick something that works for your schedule, as opposed to these big call centers, which I hate. I mentioned earlier. So it's
you're just a number. This is so cool. I'm just so excited to have been on this learning experience with you guys recently, and my audience here is learning with me too. It's just another peeling the layer of the onion of health. It's not just the food that we eat or consume. It's what we're not consuming, and even air quality. I had to learn the past couple of months. Just we're so into just food and water and what we drink and what we eat, and then it's the air, and then their surroundings and our environment. Oh wait, healthcare also too now. So enter in all of this sort of just trying to live a balanced life.
There's an ecosystem that is developing around this, which is great.
Yeah, exactly. And so it's beautiful, and I love the way it's turning out. So again, thanks, Andy, for joining us.
Thanks for having me.
And hopefully we'll have another conversation. Maybe there's more questions to answer, and I'll get back to you. But
let's do it.
But yeah, cool. Thanks.
Thanks.